Welcome to this clinical walkthrough on Tinea Capitis case for UK-MLA, brought to you by Mediate, your 24/7 practice partner.
All right, let's get started. Think of this as our roadmap for perfect consultation. We're going to cover every single step, from the moment you say hello to the final follow-up. This is the structure that's going to help you nail this station. Okay, section 1, the opening scenario. This is where it all begins. It's your first chance to connect with the patient, build that rapport, and start picking up on those all-important first clues. So, who's our patient? We've got an adult male, he's a farm worker, and he's coming in with a scalp problem that just won't go away. Your first job, as always, is to introduce yourself properly and confirm who you're speaking to. Simple, but it sets that professional tone right from the start. And listen to this. The patient says, "I've had really bad dandruff. I've tried everything, even that ketoconazole shampoo, but nothing works." Right there, that's your first huge clue. A standard treatment has failed. Alarm bells should be ringing that we're probably not dealing with simple dandruff. All right, on to the next part, mastering the clinical history. This is detective work, really. It's where you gather all the pieces of the puzzle that are going to lead you straight to the diagnosis. It's also how you show the examiner you know how to think like a clinician. So where do you start? You've got to get the story straight. Ask about the timeline. When did this all kick off? Has it changed? Has it spread? And the big one, have you noticed any hair loss? That question is absolutely key for telling a fungal infection apart from other scalp issues. Then you dig a little deeper. Is it itchy? Is it painful? And given his job, you have to ask about animals. Do you work with animals? That's a high-yield question. Why? Because we're thinking about those zoophilic fungi, which jump from animals to humans and can cause a much nastier reaction. And as you're doing this, you're building a complete picture. A great way to stay organized is to use a framework, something like PMFTOSA. You're ticking off the boxes. Any past medical history? Regular medications? Allergies? Then you get to family and social history. He lives alone, works on a farm, wears caps. And finally, treatment history. We already know the antifungal shampoo didn't work. See? Using a system means you won't miss these critical details. Okay, this is super important for scoring those communication marks. You need to explore their ICE, ideas, concerns, and expectations. His idea is that it's just bad dandruff. His concern? He's genuinely worried he's losing his hair. And his expectation is simple. He just wants something that works. Tapping into this shows you're not just treating a scalp, you're treating a person. Okay, we've got a fantastic history. Now it's time for the examination. Let's see what we can find to back up our theories. And when you look, boom, it's all there. You see scaly, red patches, you can see areas where the hair is thinning out, and then you see the classic sign, those little black dots, which are actually hairs that have broken off right at the scalp. This isn't just dandruff. This is something else entirely. Okay, before we get to the diagnosis, just a quick reminder. If you want to really nail this scenario, you can practice this exact case right now and get objective feedback on mymediate.com. It's a great way to test yourself. All right, you've done the history, you've done the exam, you have your answer. Now comes a really crucial part, delivering that diagnosis. And it's not just about what you say, it's about how you say it. Clarity and empathy are everything here. So you start by giving the diagnosis in plain English. You can say, "Based on what you've told me and what I've seen, it looks like you have a condition called Tinea Capitis." Then you immediately translate it. It's also known as scalp ringworm, which is a type of fungal infection. That way there's no confusion. This is a brilliant way to address his original idea about dandruff. You can explain, "You were right to think it was dandruff. It can look very similar. The key difference is that with scalp ringworm, the fungus lives deep down in the hair follicle. That's why the medicated shampoo you were using couldn't quite get to it. We need a treatment that works from the inside out." Okay, now for the management plan. And a top-tier plan is more than just a prescription. It's got 3 key parts. The medical treatment, of course, but also self-care advice and steps for prevention. This shows you're thinking about the whole picture. So, here's the core of the treatment. You have to explain that oral medication is a must. The primary treatment is an antifungal tablet, like griseofulvin, taken for several weeks. This is what actually kills the fungus. The shampoo is still useful, so you'll advise him to keep using it to reduce the spread of spores, but you have to be crystal clear. The tablets do the heavy lifting. Now this is where you can really impress the examiner. Give practical, easy-to-follow advice. Things like washing all his hats and pillowcases in hot water, not sharing combs. And then you tie it back to his life. Since you work with animals, make sure you shower as soon as you get home. It shows you've been listening and are tailoring your advice specifically to him.
We're almost at the finish line. Let's talk about how to close the consultation. A strong, safe ending is just as crucial as a great beginning. Safety netting is non-negotiable. You have to give the patient clear instructions on when to come back or seek help sooner. Tell them exactly what to look out for, any signs of worsening infection like pus or signs of an allergic reaction to the new medication. This proves you're a safe doctor. And of course, you always book a follow-up. Don't leave it open-ended. Say something specific, like, I'd like to see you back in about 48 weeks, just to make sure the treatment is working well and you're feeling better. It closes the loop and shows good continuity of care. One last little thing that makes a big difference. Mention a leaflet. Just saying, I'll give you a leaflet with all this information written down for you is a fantastic final touch. It reinforces everything you've said and helps the patient remember it all later. So there you have it. By mastering this kind of structured approach, you're not just memorizing steps for an exam. You're building a framework that will help you confidently manage complex cases like this one, showing you're the kind of competent, safe, and empathetic doctor they're looking for. You can practice this exact case now on Mediate.com.